for you. So welcome to our webinar this morning on the impact of COVID-19 pandemic on disabled people in low and middle income countries. This is a webinar that's presenting on the literature review that I and my colleague Vera Kubens worked on. My name is Dina Kiwan. I'm a professor of comparative education at the University of Birmingham. And this work is part of a larger project called Disability Under Siege, as you can see in the background slide. Now, this project is a specific project that is also funded by the Arts and Humanities Research Council. And the aim of this project was to develop an analytical framework to promote and support the implementation of a disability-inclusive response and recovery from COVID-19. And it's a one-year project. And the framework will cover a number of sectors: health, education, economy and employment, and social or community. And we've aimed to invoke participatory methods. We have an advisory group that we're working with as we go through this process. And the first step has been producing this literature review, which has just been disseminated, and which my colleague Vera Kubens will present on following this introduction. And then after that, we will also hear from a member of our advisory group based in Bangladesh on the situation there. The framework is actually intended to be a toolkit to support situational analyses of the impact of COVID on disabled people. And we're engaging with disabled people from the Global South throughout in the production of the framework. And subsequently, we'll be disseminating through local events and developing further resources and toolkits to local grassroots organisations as we continue through the project. So I will stop there, and I'm delighted to introduce Vera Kubens, who is the key researcher on this project. Hand over to you, Vera.
Thank you very much, Dina. So I'll be talking today about the findings from a literature review on the impact of an emerging evidence on the impact of COVID-19 on disabled people across low and middle income countries. So next slide, please. So to provide an overview of the evidence that we looked at, a literature review, as Dina just mentioned, mapped out the impacts across 4 sectors of health, education, economy, and community. And we identified a total of 113 articles that included peer-reviewed research papers, as well as what we call grey literature, which includes policy reports from UN agencies, government reports, as well as reports from non-governmental organizations and disabled people's organizations. Most of the evidence that we found actually came from that grey literature from policy reports, and most of it emerged very early on in the pandemic, in the first 4 months between March and July. Health was the most common topic covered in the evidence, with more than half the evidence focusing on health. This was followed roughly equally by economy and community, and education was the least well-populated topic, though it's worth noting that most evidence covered multiple of these sectors. So a lot of the evidence focused on the general impact of COVID-19 rather than in a specific area. We also looked at evidence that emerged from previous pandemics, emergencies and disasters, and how those impacted disabled people. there's actually very little evidence. We only found 14 papers relating to the long-term impact of pandemics and disasters on disabled people. So there's very little evidence that anything has changed as a result of previous events. I will now move on to talk about findings across each of the 4 sectors, and then give an overview of the general findings. Sorry. Okay, next slide, please. So we started by mapping out sort of the background situation across for each of the 4 sectors, which in healthcare is characterized by very weak health and fragmented health infrastructure in many low and middle income countries, where investment is often very targeted and small scale, and often leads to unsustainable healthcare structures where there's no long-term funding and that are not very robust. And that means that for many people, healthcare remains unaffordable due to poverty. Our findings during the pandemic then was that there were significant barriers to accessing protection from COVID-19 for disabled people, which included being able to access personal protective equipment, as well as hygiene facilities. And the barriers included inaccessibility of hygiene facilities, poverty, not being able to afford cleaning or facilities or cleaning equipment or masks, as well as a lack of guidance on how to use these how to use personal protective equipment that has been adapted for disabled people. For example, no guidance on how to properly clean mobility equipment. We found significant evidence of discrimination in access to COVID-19 treatment. In one global survey, 52% of people reported being denied healthcare during the pandemic. And examples of this discrimination include inaccessible quarantine centers, as well as discriminatory triage protocols that make assumptions about disabled people's quality of life and basically deprioritize people for healthcare support because they're assumed to have a poorer quality of life. Health communications were often not accessible, with only 64% of low and middle income countries having sign language interpreters. And the same study found that no international organizations, including the World Health Organization, had sign language interpreters at health briefings. And only 4.7% of health authorities globally have fully accessible websites. So as well as those access barriers, there were also language and literacy barriers to understanding information about COVID-19. In terms of the content of the communications, there was a lot of the time, the messages were devaluing and dehumanizing disabled people, with the implication that, oh, the virus only affects old and disabled people, so it's not so bad if they die, and disabled people being often labeled as vulnerable without looking at how disabled people were made more vulnerable due to societal structures and causes. There was an interruption to both routine and emergency non-COVID related care, and often disability-specific services were classed as non-essential. That means disabled people weren't able to access routine healthcare and to manage their impairments. Mental health services were also disrupted, while at the same time, there was a strong rise in suicides and PTSD symptoms that have already emerged from research in China, and similar effects have been observed from previous pandemics and disasters where there's a really strong long-term mental health impact. And that's the case for both non-disabled people and disabled people. Some of the gaps that we found in the health sector was mostly about the long-term impacts. And that includes the impact of long COVID and potentially the emergence of a whole new generation of disabled people as a result of COVID, but also the impact on worsening impairments for already disabled people, the mental health impacts. And then the other big gap at the moment where evidence is just beginning to emerge is around vaccination priority in low and middle income countries for disabled people. Next slide, please. So in the education sector, The background here is that many disabled children were already not in school prior to COVID-19. Globally, it's around only half of disabled children, and it's much lower in a lot of low-income countries where it can be as few as 1% of disabled children being in primary school. During the pandemic, school closures affected 1.5 billion children in 188 countries, disrupting education as well as access to other functions that schools perform, including access to feeding programs, access to therapy and healthcare services that are delivered to schools. Sometimes access to the only access to hygiene facilities is through schools for children, as well as safeguarding services to identify abuse, and of course the opportunity for children to socialize with their peers. Disabled children faced significant barriers to learning at home, with many caregivers and parents not equipped to deliver home learning because they didn't have the time, didn't have the knowledge on how to teach their disabled children, and learning materials were often provided by schools were not adapted to disabled children. For remote learning, access to technology and the inaccessibility of technology were both significant barriers to remote learning, and particularly in rural areas where many parents had very limited access to technology, and also particularly an issue where there were multiple children in a family, where disabled children, and particularly girls, were most likely to lose out and be deprioritized compared to their other siblings. There's also a risk of many children not returning to school because parents might think school's not important. They might still be worried about their children contracting COVID-19, and similar situation was also observed during the Ebola and following the Ebola pandemic, where a lot of girls didn't return to school because there was a 65% increase in teenage pregnancies during the school closures, with 11,000 girls that were previously in school becoming pregnant. For those that do return to schools, there will be increased attainment gaps due to the lack of access to home learning, and likely additional barriers at school due to COVID measures that make schools even more inaccessible. The gaps in this area are still very much actual data on school returns, so we can really see the impact that the pandemic has had. There's also little evidence on tertiary education. There's quite a lot on tertiary education in high-income countries, but very little in low and middle-income countries at the moment. And there's also no evidence on the impact of the pandemic on disabled parents and teachers. It's all focused on disabled pupils. Next slide, please. In the economy sector, the background here is really the link of poverty and disability, which is very strong. And this is compounded by only 1% of disabled people having access to disability benefits in low and middle income countries. The evidence so far is that poverty has sharply increased, and for many, hunger is a bigger threat than COVID-19. Where there were relief measures and social assistance being put in place, that was usually short-term and often not disability specific. And sometimes disabled people were actively excluded from COVID-19 support where they were already receiving disability benefits. In a global survey, 45% of participants reported that their government had done nothing to alleviate the impact of the pandemic in their community. There were also a number of barriers to accessing relief where it was available, including lack of information about the support available, difficulty accessing or navigating the administrative processes, including proving that you're disabled, which is very difficult, for example, if you're a refugee and you don't have any formal paperwork, and the inaccessibility of distribution points. And it's also worth noting that there's quite a few reports on disabled people's organizations stepping up to lead on the local logistics of delivering support to their members, to disabled people, because governments hadn't done so. That is, disabled people's organizations were often the ones actually doing the groundwork. Most disabled people in low and middle income countries are working informal or insecure work, and these sectors were particularly hard hit with a lack of financial support available for example, for small shop owners who were classed as self-employed but don't qualify for business loans. And for those where it was an option, remote working was often also not accessible. The gaps in the economy sector are around the actual data on the impact of poverty. I think there's already data emerging, but it's not disaggregated by disability status. So it would be really interesting to see the likely disproportionate impact that the increase in poverty has had on disabled people. There's also no evidence on unpaid and care work and the impact how that has been impacted by the pandemic, which is obviously a very gendered field as well. So it'd be very interesting to see the impact on disabled women who are performing paid, unpaid work in the household. And yes, so that's, next slide, please. So in the community, this was really sort of kind of quite a broad category where we looked at disabled people living in the community, and most people living in community are supported through informal networks rather than being able to access formal care services, which are often non-existent. So most of day-to-day care is performed by family, friends in the community. And this was significantly disrupted by lockdowns and the need for physical distancing, which led to a disruption of both formal and informal care services, and in turn leading to isolation, neglect, and sometimes death, with many being unable to get their essential needs met, or, for example, I make sure that their assistive devices were maintained, that they were able to get access to mobility aids that were actually working. The most stark example comes from China, where a disabled teenager was left home alone for a week and died because his family were forcibly quarantined and no alternative care was provided to him. There's also significant evidence of neglect and human rights violations happening in institutions where disabled people live, and in high-income countries, between 42% and 57% of deaths happen in institutions. Institutions are characterized by being often overcrowded, unsanitary, and residents have a lack of information about the pandemic. And we saw similar situations in other settings that share these characteristics, including refugee camps, prisons, and among homeless people. The pandemic worsened infrastructure barriers for many disabled people, with public transport being disrupted, lack of access to technology, and including internet access, and particularly the cost of accessing technology was a big barrier to being able to participate fully in life and kind of use these alternative methods. And as a result, many disabled people experienced difficulty accessing essentials such as food and medicine. There was also an increase in violence and abuse, including interpersonal violence, caregiver violence, and police violence, with several reports of deaf people being shot by police for not following verbal commands, and an increase in discrimination and stigma, with disabled people being blamed for the virus or being assumed to have COVID-19 simply because they're disabled. Gaps in this area around disaggregated data on the impact of disabled people in institutions and in refugee camps, prisons in these particular settings. And there's also no data on the impact of access to religious worship, as well as leisure, culture, and sports. Next slide, please. So looking more broadly at sort of the main themes that were emerging from a literature review, which were really across all four sectors, is that disabled people have not just been left behind or forgotten about, but a lot of the time they were just deprioritized and almost systematically excluded from COVID-19 management processes on a global level, and across nations. Disabled people were not taken into account and are excluded by the measures that were taken. We've also found significant evidence that there's still a large focus on medical and deficit models around disabled people, focusing on their inherent vulnerability, but not taking into account the social barriers and social structures that make disabled people more vulnerable to COVID-19. And I think that is also reflected to some extent by the fact that most articles focus on health, but not focus, there's no focus, for example, on culture at all. And it's not really a very holistic view of disabled people's lives. There's also a lack of empirical data on the impact of disabled people. So it's very important that more efforts are made to gather quantitative data. Though the issue is that even if that data is being gathered, there is often no baseline data to compare it to, because this data is just not being gathered about disabled people. And finally, there's a real interconnection of a lot of these issues and systems. So we've split them into these 4 sectors, but really a lot of these issues span across multiple sectors. For example, food poverty is an issue of poverty. It's an issue about physical access to food in the community, and it's also a health issue. If all you're getting from the government is 30 kilo bags of rice, it's likely to cause nutritional deficiencies. Next slide, please. So in conclusion, we've made the following 5 recommendations. Firstly, that further research is commissioned to gather data in some of the gaps that we have identified, particularly around the long-term impact of the pandemic, because a lot of the evidence emerged very early on and was focusing on the immediate impact. That there's a mapping of what data is currently being collected at national and international levels, who's collecting the data and how it is used. There needs to be a recognition of the interconnectedness and of all of these issues and how they all relate to each other, and funding approaches need to be aimed at building long-term sustainable systems rather than addressing issues in isolation. There needs to be ongoing campaigns to destigmatize and demedicalize disability and promote a social model approach, both in countries and in the research about disabled people. And to do that, it's crucial that there's engagement with disabled people and not only contributing, but leading this research and leading consultancy and planning processes into a disability inclusive recovery. Next slide, please. So as Dina mentioned, our next step is to use these findings to develop a framework for the UN Partnership for the Rights of Persons with Disabilities, and to create a situational analysis framework that will support governments and UN country teams to assess the impact in countries, and then use that data to build a disability inclusive recovery approach. And we're really looking to develop that framework using a co-design approach. And we're hoping to run workshops with disabled people's organizations from the Global South, because we recognize the need for expertise of people who have lived experience. And we also have an advisory group that feeds into the development of the framework, and we're hoping to develop some additional resources for grassroots organizations and DPOs, as well as a media campaign to raise awareness. Okay. Next, I'm handing over to Mohit Paul, who's a member of the advisory group, and she's the vice chairperson of the Access Bangladesh Foundation, and she'll be talking about some of the economic impacts of the pandemic and also the current situation for disabled people in Bangladesh. Thank you.
Thank you, Val. Just before I start, I want to talk about Access Bangladesh. Could you listen? Can you hear me, please? Hello.
Yes, we can hear you.
Okay, thank you. 4th January 2008, we started Access Bangladesh Foundation. Our working approach, the organization work is the true border as perspective, right-based approach and direct service-based provision in line with the UNCAPT and the SDGs, domestic law and policies. And so the organization implement project directly as well as partnership and grassroots DPOs organization following the community-based rehabilitation framework. Our focus area is the education, employment, sexuality and reproductive health, climate change and disaster, access to justice. Now I'm going to start impact of the COVID on persons with disabilities in Bangladesh. Our objective is the impact of the COVID-19 on persons with disability in Bangladesh. Data collection from the help desk run by Access Bangladesh. Data collection from 135 persons with disability through 10 DPOs, OPDs. Please next. Our data collect area, Dhaka, Shabad, Dhamrai, Gazipur, Tongi, Kapashia, and Gazipur Sodar, Norsindi, Polash, Kushipur, and Norsindi Sodar, Silet, and Chattogram. Key findings, please next. Key findings, analysis from the data, 22 employees with disabilities, 6 employees with disabilities out of 22 got full salary March and April 2020. 11 employees with disabilities out of the 22 got 60% salary in the month of April in 2020. 5 employees with disabilities out of the 22 did not get any salary in the month of March and April 2020. From among 20 factories, and 16 factories have restarted their operational oils and 4 still closed. Some factories have reassigned their employee those jobs duration less than 1 year. Analysis from data of 134 persons with disability in general, coronavirus pandemic has affected with the well-being person with disability, as most of the respondents express that their entire community under quarantine and lockdown restriction. Some factories have restarted their operations in the small access, and those are not able to join, they get only 65 of their salary, which is insufficient, and the employee with disability to community their livelihood. Almost the employee with disability are staying their village home, and they are not able to joining their workplace due to the government imposed restriction in traveling and movement. The person with disabilities who are staying in at village due to the government restriction are not able to work from home due to the nature of work. The employee with disability are worried for not getting salary in the last month as March, April 2020. Priority identify, and the person would, next please, the added accommodation, economic impact of the COVID-19, received funding, salaries, financial assistance for house, food, daily accommodation, medical support, information, continuation the job opportunity, the work. I just missed one slide. They are suffering from the anxiety due to the fear of job loss, the factory layoff, cancellation, the order, postponement and order, etc. Many of the persons with disabilities are facing problem with getting food and cash money. The responder especially do not have caregiver and medical support. But all persons with disability do not have access to provide equipment. Discrimination experienced by the person with disability during the coronavirus pandemic is that they have unable to access government by they have government, private, and provide food and other support. The greatest concern of the person with disabilities is the personal economic impact in person response to COVID-19. Priority identify a person with disability and addresses the economic impact of the COVID, receive pandemic salary payment, financial assistance, housing, food, daily commodities, medical support, information to continuous job when we want to work, opportunity to work from home, income generating activities, access to mental, psychological support. And it was last year we are finding the last year we just was the it was from a study we found it, but the situation was really very bad. And then I'm talking about the September 2022 February. That time it was we start our work, meaning the Bangladesh start our work with the health distance marks and sanitation, meaning the taking health care. And that time also they did not get back their job. And my country again started a lockdown. Its situation is what Bara is explaining. Many things is the same as us, as a situation is us, and facing big problem in the last February, last 2020 February to now, our school is closed. Some 30% of the student they can join in with the online, but 70% of the student they cannot join with the schooling. And especially I'm talking to who is the severely disabled as well, intellectual and autism and deaf, that their situation is the more very bad situation. They cannot join the school and other also. Then in our situation we don't have also caregiver. Parents have to look after them 24 hours. It's very hard and it's very hard about the schooling and other and lockdown again. This lockdown again, the economically they are very bad situation. They lose their business and other, and lot of the personal disability they lose also job. Health condition also on the same thing I'm repeating what Bara said. This is the really not good situation. We don't know how to manage this pandemic time. It will be better if anyone asks question, then I will answer, because I'm repeating many things that what Barras told. Thank you. Thank you very much.
Thank you very much, Mahua, for that presentation. We've got a bit of time. We've got about 20 minutes for questions, so please do type your questions in the chat or in the Q&A box, and we'll do our best to answer them. Looks like we have a couple of questions. So the first one is from Kate. Say thank you for this wonderful presentation and impressive review. You mentioned that some of the next steps are to hold workshops and create resources for DPOs. Can you tell us more about A, what gaps are needed, gaps or needs will be filled by these workshops and resources? B, how these gaps, needs, opportunities were identified, or if this work is yet to come to this level of detail, what is the vision? Thank you. So really the idea of the workshops is to enable the input of disabled people from the Global South with lived experience of the pandemic to feed into the development of the resources that we are developing for the UN Partnership for the Rights of Persons with Disabilities. So the framework will be informed by our findings from the literature review, but we also really want to make sure that there's the opportunity to input and that we can make sure that we are on the right track with what we're developing throughout. So that's why we have an advisory group of disabled people with expertise and lived experience from the Global South that will feed into our work, where we're really looking to engage kind of further with disabled people's organizations through that process. And the idea is that that will kind of also serve as a way of identifying the needs or gaps of where there's additional advice needed and where government should really be focusing on. And again, what we're really looking to work with the groups to find out what resources would be most useful for them so that we can develop them. I hope that answers the question. So the second question is from Nia, which says the findings are really insightful. However, yet I wanted to know, how was the contents of the COVID related information? Were they really accessible, usable for persons with disabilities? Along with that, what was the condition of access of persons with disabilities in SRH services? Is there any particular findings? So we found, I think one of the key findings was that access to information was a real problem. So as I mentioned, there were some studies around the lack of sign language interpreters at briefings, around the inaccessibility of websites, and there's really a whole lot of issues around accessing information. A lot of people got information not from official sources, but from disabled people's organizations who did a great job informing their members of the issues and of the symptoms of COVID-19. But there was also issues around misinformation, about sort of a lack of trust of government, as well as just information not being accessible. Moving on to the second part, conditions of access of persons with disabilities in SRH services. Is that sexual and reproductive health, I'm assuming, SRH? I'm going to assume it is. I think that was one of the areas that was particularly highlighted in our report as well, is that it was a big issue for disabled women to access these services, because again, SRH tends to be one of the sort of the first things labeled as non-essential, and access for this, particularly for disabled people, is not necessarily considered. So there was actually, that was one of the areas specifically highlighted in our literature review as significant, where there were significant barriers as a result of the pandemic. I'll also share the link to our full review in the chat if anyone wants to have a look at the full 70-page literature review, but there's also a short summary of our key findings at the start of the review. I'm happy to take any more questions.
There's a question from Tess in the chat.
Okay, yep, just seen it. Thank you for the workshop. Do you have any more details on the media plans you mentioned at the end of the first presentation? We haven't really at the moment. We're kind of currently developing the second phase of the project. So we're looking at sort of how we can increase the impact of the framework that we are developing. And I think we're considering potentially applying for some additional funding to do some more media activities, and particularly because it's an AHRC funded project. So there's a sort of a strong emphasis on the cultural aspect. So we're potentially discussing making a short film about the impact of COVID-19, but I think focusing on sort of awareness raising is not always useful, but I think in this case, a lot of the issues are around disabled people just not being considered. So there's some value in focusing on just raising the profile and making people aware of the systematic exclusion that's happened of disabled people during the pandemic. Okay. Any other questions at all? Another question from Samuel in the chat. Thank you all for a wonderful presentation. What do you think is the impact of COVID-19 and social protection systems in the Global South? Do you plan on having some recommendation on the need to revamp the social protection programs in low and middle income countries? Samuel Odawa from Kenya, a proud alumnus of the University of Birmingham. Yeah, I think that's one of the key findings, is really highlighting the inadequacy of existing social protection systems, and the fact that globally, where governments took measures, they were often basically just almost like a plaster to stick on, but they weren't really equipped to address the long-term impacts of COVID-19. So the very short-term relief measures to help people, but basically providing the bare minimum to help people survive at best, but not really addressing the impact. So there's a real need to sort of address the issues properly, and again that focus on sustainability rather than just fixing issues temporarily, and that will be one thing I think to focus on in our framework, is highlighting the importance of having those sustainable protection systems in place and making sure that they are specifically targeted towards disabled people and address all the additional barriers that disabled people face, including having just disabled people tend to have higher costs of living, like the disability tax. You just need to spend more. Being disabled is expensive basically, and disabled people are more likely to be in poverty. So recognizing that in social protection systems, and we're working with colleagues at the University of Bath who are experts in social protection in low and middle income countries as well, to produce a paper on this, and it's going to be a strong focus on in the development of our framework. I've got a couple more questions in the Q&A from Maria. Thank you, Vera and Sarah, for the insightful presentation. Was any of the data collected from Bangladesh used by the government or OPDs moving forward? Mahua, do you want to answer that question?
Could you again explain this question?
The question is in the chat, and it's in the Q&A section rather, and it says, was any of the data that you collected from Bangladesh either used by either the government or disabled people's organizations moving forward?
We have also data problem, but to research is very small what I presented today, but not actually data is the big problem in Bangladesh. We don't have data.
Okay, thank you. We've got another question from Pedro. Thank you for such insightful and informative presentations. I have a question regarding the provision of arts and culture and how it might alleviate or not the impacts of COVID-19 in the lives of disabled people. Have you found anything relevant in the literature? I think in the 113 articles, there was one mention of arts and culture, which was around the lack of access to Braille books for blind people. Apart from that, it was completely absent. So there very much the focus was around health and around economy, but there's a complete absence of focus on access to culture, access to religion, religious worship as well. So again, I think that really highlights the ongoing medicalization of disability as either an economic issue or a health issue, and not really looking at the importance of disabled people being able to access all areas of life to have a kind of a full life. So, any other questions? Okay, if we have no other questions, thank you. I think we're going to start closing. I just wanted to say thank you to everyone who's joined us today and asked questions and engaged with us. And we'll be sending out a feedback questionnaire to you in the next week or so to gather some feedback on the event. The recording will be available on the project website and on YouTube as well. And I'll just see if I've just put the link in the chat. I'll just do that now for the full review if anyone wants to read the full review. And yeah, we'll be in touch with anyone who might be interested in participating in our workshops to develop the framework as well. That would be really exciting. So there'll be an opportunity in the feedback questionnaire to indicate whether you'd be happy to be involved in that. Thank you very much, everyone. Thank you also to Victoria, our BSL interpreter, and our Captain Obo for their work to support this webinar.
Thank you to everyone for their time this morning, and we hope to continue, to be in dialogue with you and to hear from you. We're delighted that you've connected with us this morning, afternoon, or evening, depending on where you are. Thank you.
Thank you.
Thank you.